If you want to learn everything you need to know as a nurse about direct thrombin inhibitors, then this is the video for you. Direct thrombin inhibitors such as argatroban, dabigatran, and bivalirudin are anticoagulants that are easy to remember because they end in gatroban, gatran, and iridine. Direct thrombin inhibitors are used for the treatment and prevention of clots, also called thrombi, such as with deep vein thrombosis, pulmonary embolisms, ischemic strokes, heparin-induced thrombocytopenia, and for percutaneous coronary interventions, also called PCIs. Direct thrombin inhibitors work by interrupting the coagulation cascade. They block thrombin, a protein also known as factor IIa, which is required for converting fibrinogen, also known as factor I, to fibrin, also known as factor Ia. Therefore, direct thrombin inhibitors indirectly block fibrin, a sticky protein that creates a mesh that holds platelets together to create and stabilize a thrombus. Bivalirudin, also known as Angiomax, is an intravenous direct thrombin inhibitor that is most commonly used during and immediately after procedures involving the heart and blood vessels, such as a PCI. Bivalirudin therapy is monitored using a point-of-care test called an activated clotting time, also known as ACT. ACT measures the amount of time it takes for blood to form a clot. The normal value sits between 70 to 120 seconds. However, an ACT of 150 to 600 seconds is the goal while on anticoagulant therapy. The most common complication of direct thrombin inhibitors is bleeding. Because direct thrombin inhibitors increase the risk of bleeding, it is important that individuals on this therapy avoid injury, such as intramuscular injections and high-impact sports. If an injury does occur, especially with possible injury to the head, such as with a fall, it is important to monitor for neurological changes due to the increased risk of an intracranial hemorrhage. Additionally, substituting for a soft bristle toothbrush and an electric razor instead of a blade for shaving is suggested. It is also important to monitor for bleeding from gums, nose, and wounds, or for blood in stool or urine. To monitor for internal bleeding, periodic CBCs may be completed, and if bleeding does become a concern, idarucizumab, the antidote, can be administered. Additionally, direct thrombin inhibitors should not be used during any active bleeding, such as a recent trauma or a gastrointestinal bleed. Aspirin and NSAIDs should also be avoided, as they further increase the risk of bleeding. And finally, orally administered direct thrombin inhibitor therapy should not be stopped abruptly, as doing so increases the risk of thrombus formation. This wraps up everything you need to know as a nurse about direct thrombin inhibitors. I hope you found this video useful, and if you did, please show your support by giving this video a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!